Hi everyone, welcome to Bold Conjectures with Paras Chopra. Today I'm with Gregory Zuckerman, who is a journalist with the Wall Street Journal and author of several award-winning nonfiction books. His book, The Man Who Solved the Market, profiled Jim Simmons of Renaissance Technologies, which is perhaps the most profitable quant fund ever, and perhaps the most profitable fund, quant and non-quant. The book was #1 bestseller on New York Times list and won the 2019 Financial Times McKinsey Book of the Year award. His most recent book, A Shot to Save the World, which I have with me here, is a behind the scenes account of how COVID-19 vaccine was developed and launched within a year of the pandemic start. This achievement is unprecedented in history because vaccines generally take many years and sometimes even decades to get developed. So what did we do differently this time? Well, that's a topic we're going to explore today. Welcome to the podcast, Gregory.
Great to be here. Thanks for having me.
So actually, I wanted to start with how do you select a topic to write a book on? Quant funds and COVID vaccines, these two couldn't be more different.
They are different. I like to write about big accomplishments, something that has either changed the world or an industry, and figure out how it happened. I wrote The Man Who Solved the Market to explain how Jim Simons became the greatest moneymaker in Wall Street history and modern finance, and tell the story of sort of how quantitative finance evolved, modern quantitative finance evolved. And this book obviously is about how we develop these effective protective vaccines so quickly. So I look for big accomplishments, and I also try to I like to shed light on individuals, on groups, on scientists, researchers, etc., and explain how they pulled something off that's remarkable, at least in my view.
Right. I guess one of the connecting threads between the two books is their hard technical achievements. There are achievements in terms of impact, but they're also like very technical in what the people end up doing.
That is true. The other commonality, and it's true of all my books, this is actually my fourth book of nonfiction. I try to write about unlikely heroes, unlikely individuals who pull something off tremendous and huge. So you wouldn't have thought that Jim Simons would be the greatest moneymaker in financial history. He's not, and his colleagues even more so. They're not inherently interested in finance. They're not traders. They're not investors. I grew up reading all the most important investment books, learning about finance. These individuals don't care really. They're not people who read about Peter Lynch and George Soros and all the greats, Warren Buffett, etc. So it should not have been Jim Simons and his colleagues to have created the greatest trading firm. And the same thing is true. I like that theme. The same thing is true with the vaccines. The vaccine giants should have been the ones to have saved us. That's Sanofi, that's Merck, that's GSK. Instead, it was companies we had never heard of. Even people who write about biotech were skeptical about these companies, Moderna, BioNTech. They're not people, the group at Oxford, AstraZeneca. These are not the vaccine giants. So that's another theme that I'm very partial to, the unlikely hero.
Right. And before we get into COVID vaccines, your previous book on Jim Simmons, he's famously very secretive, reticent. Before I read your book, I didn't know even any interview of his existed on the web. No idea about how they generate these massive returns. So, do you think it's also part of a challenge that you seek to find out what doesn't exist in the public view and get it out in the public?
Yes, I think that's a good point. So I do like a good challenge, and I like a story that hasn't been told. So there have been a million books about some of these other investors, Warren Buffett, for example. but there had never been a book about Jim Simons. And I also like when people tell me not to do it or that I can't do it. And a lot of people said, don't waste your time on both my books. This last book, my kids told me not to write a book about the vaccine effort, partly because when I was writing it, it wasn't clear what the results would be. So my risk was wasting a lot of time. What if I had spent all this time on some of these companies, these researchers, these scientists, and it turns out that the vaccine wasn't effective or just somewhat effective, partially effective? I would have wasted a lot of time. Also, a lot of these companies didn't want to talk to me, the researchers, the executives, etc. So I like a good challenge. That's a very good point.
Fantastic. So before we get into why startups ended up developing the vaccines and not the giants, I want to ask you to do the impossible. You dedicate the entire book uh, talking about how the vaccines were developed, and you go way back in history. But for the benefit of listeners, can you compress and maybe give a very high level history and timeline of the vaccine? I know it's going to be extremely difficult, but feel free to pick and choose whatever you deem important.
Sure. So I write about pretty much all of the successful vaccine efforts. That's in the United States, especially. That's the two mRNA ones, messenger RNA. We can talk about what that is. I can explain that simply if you like, but those are the key approaches used by Pfizer and BioNTech and by Moderna. I also write about the two adenovirus approaches. That's Johnson and Johnson in the United States here. Elsewhere as well, a little bit Johnson & Johnson, and the Oxford AstraZeneca effort. And then there's a third approach called the protein subunit approach, and that's Novavax. And some of those vaccines are more valuable here. Some are more valuable in other countries, India and Africa and Europe. But basically, my book is about the evolution of these approaches. And I go back in history and I start with HIV, the effort to develop a vaccine for AIDS. And I do so because I kept hearing about vaccines for AIDS and the work as I was doing this research. And I kept saying to the people talking to me, the scientists, well, correct me if I'm wrong, but there's no vaccine for AIDS yet. So why do you keep talking to me about HIV? And they said, no, Greg, we don't have a vaccine for HIV yet, but we learned so much in the process. And I'm an outsider, and I always saw that effort as a failure. They tried, they worked very hard, but they failed to develop an HIV vaccine. But there's no failure in science. That's one thing I've learned, and that they learned all kinds of things along the way. They learned about the immune system. They learned about how to conduct big trials, but they also learned how to develop this approach called the adenovirus approach. You can read about it in the book. And it failed for HIV, and it was an awful experience. And Merck closed down its whole group, and there was embarrassment, and they were jeopardizing people's lives. Forget about helping people. It was potentially hurting people. But from that effort came a technique, this adenovirus approach. And it didn't work for HIV, but it did work for COVID. So the reason I go back in history is partly to understand the evolution and to reassure the reader. A lot of people heard about these vaccines that came together so quickly in 330 days in the United States, from sequencing the virus till the Pfizer BioNTech one was approved, or at least authorized. That's a crazy short amount of time, but my book shows that, well, actually, yes, it came together quickly in 2020, but there were years and years, even decades of work, slow, persistent, stubborn scientists using innovations that took years. And I think it's important that people appreciate that. But the other reason I go back in history is because we need to appreciate these vaccines. And only by seeing a failure such as with HIV, I think, do you fully have gratitude and appreciation for the enormity of these accomplishments. So that's partly, I want to plant the seed. I want the reader to appreciate a little bit more these vaccines that we have today. And one way to do so, I think, is to explain the failures of the past.
Right. Yeah. I mean, that's perhaps the most striking thing about the book, where from the outside, it seems like COVID vaccine was developed in such a short period of time, but the background context that it took, the input of thousands of researchers over decades, it just shows that science is cumulative, and you rightly said so, no effort is wasted.
Yeah, and listen, my book is about creativity and it's about innovation and it's about how to get really brilliant, stubborn, difficult people sometimes to work together on a goal. So I tried to write it for a scientific audience, but it's really for everyone because it's about innovation and about creativity and it's about persistence and things that I learned and what I admire from these researchers, these scientists, these executives, these investors, venture capitalists as well. So to me, I learned a lot from the research that I think can be applicable to all kinds of different areas.
Right. So as you were saying, startups were the ones who ended up developing the vaccines and not big companies. So how would you contrast the decision making between these two groups? I remember reading in your book, at least for BioNTech, the decision was just very sudden, where the founder of BioNTech decided to just pivot the company and focus on this. And it was quite remarkable to see such a sudden change, which I imagine wouldn't be possible in large companies.
Yeah, it's a great question, and it's an important theme. On the one hand, it's surprising. It should have been Merck. I mean, Merck developed the vaccines for measles, mumps, rubella, Sanofi, GSK. Again, those are the vaccine giants, and yet they haven't done much at all. And I write about why in my book. To some extent, it's expected, and to some extent, it's surprising. It's surprising again because they're the experts, and they tried. I write about how within Merck there was a fight, there was a rift. Some scientists said, "We're Merck. We should be the ones stepping up and developing a vaccine." And others said, well, we've got this cancer franchise. We don't want to take our eye off the ball. What if this virus peters out? It turns out it's not a big deal. Remember those earlier coronaviruses, MERS, and the earlier SARS. They made arguments that were justified to some extent. They're not unjustified arguments. And in the end, Merck spent a little time on an effort for a vaccine, but ended up putting that aside and working on a drug. It hasn't worked so well. And I say, so that's unexpected, but in some ways it's expected. To your point, if you look at industry after industry, it's usually the startups. If you look at, I don't know, e-cigarettes were developed by outsiders to the tobacco industry. You look at energy drinks, Coke and Pepsi, they had to buy the energy drinks. It happens all the time in the pharmaceutical industry. Well, biotech develop something and the pharmaceutical companies buy them out. Industry after industry, you can go on and on. Search, what about search? I mean, Microsoft had a group doing search, believe it or not, and they closed it down. They looked at the industry and they said, we're going to move on. And Google became what it is because Microsoft didn't do search. So it happens over and over again, and it happened here as well. And in this particular example, with the COVID vaccines, I think it's important to remember that vaccines until 2020 were not a popular business for pharmaceutical companies, for biotech companies. You didn't really want to focus on vaccines. Vaccines are given once in a lifetime, once every few years. Whereas a drug like a statin, I take a statin every night. So that's the ideal business for a big pharmaceutical company, a drug that can be given over and over again regularly. And vaccines, you can work on a vaccine. It's expensive. What if it doesn't result in success? Even if it does, what if the pathogen, what if the virus goes away? So for a lot of different reasons, vaccines were not a popular business, which is another reason why these upstarts, they had a lot less to lose. So like you said, BioNTech in January 2020, they had never had an approved drug, never had an approved vaccine. They had developed some approaches they were working on. They were excited about them. They were optimistic, but no one else was nearly as optimistic as their own executives, their own scientists. And Ugur Sahin, he got nervous about this new coronavirus. And he said, hey guys, we've developed this approach using messenger RNA. And again, I could spend just a couple minutes talking about what that is. Let's shift all our resources and try to be the ones to develop a vaccine. And again, they had a lot less to lose than Merck. Merck had huge franchises, cancer drugs, etc. So they didn't want to get distracted. So I think that's part of the reason why Moderna, BioNTech, Novavax, this little company at $3 a share going into 2020, they were running out of money. They were about to close down. People were sending resumes and leaving the company. And I think they had less to lose. So they risked it all to develop these vaccines.
Right. This is the classic innovator's dilemma, which was just clearly laid out in your book, where the big companies has so much to lose. Particularly around focus. I think the whole question about, I think the one thing that came up again and again in your book was this questioning by big pharma groups. What if this pandemic just peters out automatically by itself? And they were weighing doing this cost benefit analysis. And I think that was the cause of their paralysis versus startups having not much to lose, just bet their entire trajectory to this one thing.
Yes. And on the one hand, my book is about science and it's a book about these vaccines, but in some ways there are broader themes that I think are applicable in the tech world and other kind of worlds as well.
Right. Another theme that was quite prominent in your book was the sense of cooperation between different entities, different individuals. So I wanted to pick your brain on this cooperation versus selfishness. There was selfish behavior as well. So what did you really observe during vaccine development? Was it more cooperation? If someone was selfish, what made them selfish? And generally, what do you think it says about human nature when you look at it at a broad overview?
It's a good question. So just taking a step back, with this book, and I think my other books too, readers have said to me, Greg, I enjoyed the book. I don't know about these characters, though. I don't know if I like them or not. And these are people that have literally saved lives all over the world. And yet I understand that impulse, that reaction that people have. Let's say Adrian Hill. Adrian Hill ran this group in Oxford. For years, he was somebody who was detested in the world of science, disliked, and for good reason. He would get up at meetings, scientific meetings, and just rip into his colleagues, people in other institutions. You don't know what you're doing. You're making a mistake. It's foolish. Why do you think you're going to make any progress with that approach? Just really vocal and insulting even. And yet, and he was somebody who would go on television and talk about the progress his own group was making at Oxford, and they're going to build a vaccine for malaria and a vaccine for this and a vaccine for that. And yet on the eve of this pandemic in early 2020, he had never produced anything, he and his colleagues. So do you like a guy like that? And yet there are reasons to like him. He was persistent. He wants to save lives. But does he also want to get rich and famous? Yeah. And that's true of Stéphane Bancel. I mean, Stéphane Bancel, the CEO of Moderna, he pushes his people so hard. Early on, you'll read about it in the book, people were trying to keep up with him. They were hitting their heads. They were collapsing in the office. They were collapsing in the parking lot, collapsing at home, hitting their heads, going to the hospital. He would fire people like that. And yet he was also inspirational. He said, we're going to be the ones to step up someday and save lives. And a lot of people who worked for him loved that. And he believed, and he was hardworking, and he had a goal. So getting back to your point, I think a lot of the characters in my book have mixed motivations. They want to get rich. They want to get famous, but they also want to save lives. And that's okay. I'm a big believer in gray characters. A lot of other authors have black and white characters in their books, and I get why they do that, and heroes and villains, but life isn't like that. So I'm a capitalist. I work for the Wall Street Journal. I believe there are a lot of reasons to criticize capitalism and especially the inequalities, and I can go on, but it's a better system than most others. And I believe in incentives, and often financial incentives motivate people. So getting back to your question, a lot of the characters in my book are motivated by many different things. And even the academics that I write about, they clearly want to save lives and help society, but they like fame as well as the next person too. And that's okay. There's nothing wrong with that. As long as the ultimate goal is a net positive for society, and all these people I believe are bringing a positive, then it's okay to be motivated by multiple things, including fame and fortune.
Yeah, I guess the topic of profit in the pharma industry for vaccines is a hugely polarizing topic. I think that's partly because I think people understand if you remove the incentive, the investment itself would come to a halt. I mean, I just came across this article from Oxfam that said Pfizer, Moderna, BioNTech are making $1,000 in profit every second, while world's poorest countries are largely unvaccinated. So I mean, and of course, there's a huge debate in US on medicine prices and so on. But again, is there sort of a limit to how much you expect companies and people to profit, especially during times like pandemics?
So it's a great question. It's a difficult question. I struggle with it myself. I'm not some believer that greed is good. You're too young, but there's the famous Wall Street movie Wall Street, where the raider, investment banker, corporator, kind of say greed is good. Listen, I'm not going to defend greed and gluttony and making all this money during a pandemic, but it's very easy to criticize now and say, oh, just give away these drugs, etc. I want to make sure there are incentives for the next Moderna, for the next BioNTech, for the next Pfizer, for the next breakthrough, the next, be it cancer, be it HIV, be it these all kinds of other viruses, that pathogens that these companies are working on. So I have to say that these companies, let's say Moderna, for example, it started in 2010. So from 2010 until 2020, for 10 years, they didn't have any profits. So that required billions of dollars of venture capital and small investors to write checks over and over again for this company. And the only reason they did so was the hope that someday there'll be huge outsized profits. That's the only reason why these huge company investors from all over the world, but also small investors, wrote these checks. And now to say, well, you're making too much money, Moderna or one of these other companies, I'm a little uncomfortable saying that, because I don't want to prevent the next investor from writing a big check for the next company. And as you know as well as most of your audience, most of the time when it comes to these kind of investments, they don't work out. So they have a portfolio. Don't feel sorry for these investors. They have a portfolio. So they have, let's say, 10, let's say 20 of these kinds of Moderna investments, and most of them go to zero. But a huge, enormous windfalls from Moderna hopefully will result. So if I'm going to go and say, well, Moderna, now you can't have that windfall, I worry that we're not going to create the next Moderna and have a next breakthrough. So I think there's some balance, right? There's some balance here where you create enough incentive and people get rich. I don't mind that, as long as it's not at the expense of slowing down progress and sharing vaccines. And we need to do more work on that kind of thing. But as you can tell, I'm sort of torn by it.
Yeah. I guess this brings to another important topic, which was, again, quite evident in your book, on value creation versus value capture point of view. A lot of what Moderna and other companies did, I think they built upon decades of basic research that was funded by the public. Essentially, government agencies fund basic research, and startups end up sort of commercializing it. So do you have thoughts there? Was it fair for a lot of academics who were involved not getting any part of Moderna's $68 billion valuation or BioNTech's $40 billion valuation?
Yeah, it is troubling issue as well. So I do spend a lot of time in my book writing about the academics and the academic breakthroughs, and not just the government academics, but the universities. And for mRNA to deliver these vaccines the way this approach has, it was not possible were it not for these academics I write about, the professors, John Wolfe and Ellie Gilboa at Duke, and then Carrico and Weissman at University of Pennsylvania. Then these two academics I write about, Warren and Rossi at MIT. So we do have to give them credit. Often, especially today, more than ever, the academics, they do get incentive and they do get rewarded. Their institutions sometimes do as well. So MIT and their academics have made a ton of money having pieces of these companies and having pieces of the intellectual property, the patents and such. So it's really the government that hasn't really benefited as much. The academics, the universities, they're very sophisticated and they negotiate hard. So don't feel sorry, at least in the West. Don't feel sorry for the academics. And all these academics, I have to tell you, they have these two hats. They're teaching, they're doing research in the academic labs, but they're also having meetings in biotechs, and you probably know as well as I do, they're VCs, and they're very sophisticated, much more than I had expected, and more so than other areas of academia. My brother's an academic, my late father's an academic, social scientist, not in the world of biotech. And the biotech academics are very sophisticated. They know how to get a cut of everything. They're always thinking about patents and intellectual property. So it's really the government that should be benefiting a little bit more, to your point. And they should be hiring some of these academic negotiators to push a little harder, perhaps, and get a little equity. I think that is a problem. Sometimes they don't get equity in these companies. They should be negotiating. Sometimes they will get some benefit, some financial benefit, but I would love them to get some equity as well.
Right. Yeah. I mean, it's surprising. Government does give a lot of grants for research, but I mean, it could act as a limited partner in many of these venture funds as well.
Even a limited. Be a limited partner. Yeah.
So switching gears a little bit, could you explain the three types of vaccines, maybe overview of science of how they are different, and also maybe talk a little bit about why do we need a variety? Why couldn't we the world do with just one type of vaccine?
Sure. So why don't I take a step back and just tell you what a vaccine is. A vaccine is really just an education for the body's immune system. We introduce a piece of a virus, generally speaking, if I can generalize, to teach the immune system, well, here we are introducing it. We're educating you about this virus. So if you ever encounter it for real, you'll know, immune system, you know how to go fight it off. And historically, we used an approach using an attenuated, a weakened version of the actual virus, or a piece of it. So, or a killed version of the actual virus. But that takes a long time. It's expensive. Sometimes it could be dangerous. Like with AIDS, we really don't want to put a piece of the AIDS, the HIV virus in you. So for this reason, there always were attempts at different types of vaccine approaches. And the three that have worked for this one, in particular the mRNA ones, they're all revolutionary, and that's the future. And they're much faster and cheaper than the existing, again, the old school approach is you kill it, you kill the virus, or you have a piece of the virus, or you weaken the virus. But mRNA is a whole new world. So I'll explain what mRNA is. mRNA stands for messenger RNA. Messenger RNA is just a molecule. We all have it inside of us. It is a molecule. It's a really important molecule. It delivers the message from the DNA in our cell to the part of our cell where proteins are created that keep us alive. So the messenger RNA, and then it gets chopped up and eliminated right away. So it's a fascinating molecule. We all depend on it. We all need it inside of us. And again, it delivers the message within the cell from the DNA to the part where it's created, and the proteins are created, and the rest, and keeps us going. So scientists always said, well, if mRNA, this messenger RNA, is so important, why don't maybe we could create it in the laboratory synthetically. In other words, just like you have something like sugar, naturally in nature you have sugar, well, you can create sugar in the laboratory too, and it's pretty close, right? Sometimes you can't tell the difference, often, whatever. So the scientists said, well, what if we could develop mRNA, develop this molecule in the laboratory to send a message to the body by way of a drug or a vaccine into the body to create any kind of protein we want. And the wonder of that, the promise of that would be, well, if you could tell the body to create any protein, you could have the body itself be its own factory, its own medicine factory, drug factory, vaccine factory. You could tell the body to do anything you want. The possibilities are endless. So, but just as quickly as people got excited about that idea, mRNA, creating it in the laboratory, scientists usually said, don't waste your time, forget about it. That's because, remember when I said a second ago that mRNA gets chopped up almost immediately in the body? So that's the thing. It's a very short-lived molecule. So the scientists said, well, why are we going to spend all this time and spend all this money on a molecule that gets chopped up and eliminated right away? How much can it really do in the body to create proteins, etc.? Let's not waste our time here. And it's also the case the body's immune system has ways to fight it off. So most scientists said, yeah, mRNA hypothetically could do some good things if we create it in the laboratory, but don't waste your time. It took some stubborn, persistent, resilient, innovative, creative researchers that I write about in my book to ignore the conventional wisdom, to ignore what all the experts said. And that's what my book is about, the evolution of that approach. So I won't tell you right now all the details, but it took years of work, and it was a little bit like a relay race where you have somebody running the race and look like they're going to win, and then they kind of stumble and they fall, they trip, and they pass the baton to the next group, to the next runner. And he or she picks it up and runs and looks like so it's a lot of stumbling along the way and how to deal with those stumbles. And that's kind of what my book is about. And eventually they developed this approach called mRNA, where you can send a message to the body to create a protein. You have to encase the mRNA in this thing called a lipid nanoparticle. You can read about it, etc. And the key is you can send a message to create a protein. And so what's the protein in this case? Well, it's the spike protein, which is like the hallmark of the coronavirus. So the whole idea with all these vaccines is you send a message, you tell the body, create the spike protein. The body's immune system says, wait, hold on a second. This looks foreign. This looks dangerous. I'm going to go fight this thing off. And that's why when we get the vaccine, sometimes there's a bit of a reaction. That's the body's immune system reacting to this spike protein, but the body has been educated. So that's the mRNA approach, and you can read about it in the book. The other approach is the key approach is the adenovirus approach. And the adenovirus approach, which led to the J&J vaccine, as well as the AstraZeneca approach, AstraZeneca-Oxford approach. That one says we're not going to use mRNA to send a message to the body to create a protein, but we're still going to send a message to the body to create a protein. But that genetic message, we're going to put in a virus, an actual virus. So J&J uses a cold virus that people haven't encountered, and the Oxford AstraZeneca uses a chimpanzee virus, actually. That's called the adenovirus approach. And the idea is to send that same genetic message, the message, hey, go create a protein that we're telling you what to create, but they're putting it in an actual virus, injecting it in the body as part of this vaccine. Why a virus? Because a virus is good at spreading in the body. So the virus spreads in the body. The body gets the message. The virus goes away. It's not a dangerous virus. It's been genetically altered so that it doesn't hurt anyone. And then again, you've sent a message to the body to create this protein.
So the adenovirus approach, it's different from previous approaches in the sense that previous approaches use the virus itself, for example, attenuated or inactivated coronavirus, but here they're using a different virus with coronavirus DNA.
Right. So the old school approach uses a piece of the actual
Okay.
virus. And the adenovirus approach doesn't use the coronavirus at all. It just uses these inactivated, I would say these um, genetically altered viruses, a cold virus or a chimpanzee virus, to send a message. It's just, it carries a message with it. And the third approach is called the protein subunit approach. And in that approach, you actually do send in the vaccine the actual protein from the coronavirus. And that's the Novavax approach is using that.
Right. And I mean, we have three types of vaccines, but if we had one world government with just one project, do you prefer putting investment into one project, or do you think this diversity is actually helpful?
So while we were developing these, we weren't sure which was going to work and which was going to work the best. So there was money, both government money and private money, behind all approaches. The advantage of all three of them is that they're all relatively fast and inexpensive compared to the old school approach of the killed or inactivated virus approach. In hindsight, it might have been best just to invest in mRNA, but then again, mRNA, it's more effective. It's the most effective vaccine. It's safe, but there are drawbacks as well. For example, it has to be held and stored in cold temperatures, the mRNA vaccines, whereas the adenovirus vaccines and the protein subunit vaccines don't have to be kept in such cold temperatures. So the mRNA one, so it's nice to have a mix of them. Yeah. So especially in areas in Africa and elsewhere where they don't have those facilities, the cold storage facilities, the other approaches haven't quite helpful. So it's nice to have a mix, and it's also good to have like with a portfolio, you want to bet on a few different potentials because you don't know which was going to work out.
Right. One of the many sort of interesting events narrated in your books that caught my eye was I think it was AstraZeneca, where they took a bet on manufacturing in parallel to while the clinical trials were happening. And that's unprecedented, betting millions and billions of dollars on something which might turn out to be completely ineffective. What was your response when you learned this, and what made them decide this?
They all did that. So
okay.
It's a really important point to understand. So I give speeches about my book to audiences, and I speak to some people who are vaccine hesitant. And listen, you've got some people who are unreasonable. They say that Bill Gates is putting a chip in our body and is tracking us and that kind of thing. It's hard to reason and have a conversation with those people. But other people say, well, Greg, didn't I read in your book that the average vaccine takes 10 years to develop? And the fastest one in history until 2020 was 4 years. And then you're telling me I should be comfortable taking a vaccine that was developed in 330 days. And the way I respond to them is along the lines of your question. What had never been done in history was doing different stages in vaccine development and production, et cetera, simultaneously. So in other words, historically, what do? You spend years working on a vaccine approach, and then you do testing and trials. And then if that all works out, then you start manufacturing it. You would never manufacture a vaccine before it was approved or at least authorized. Why would you spend billions and millions of dollars to do that? No one's ever done that before. The difference this time around is there was a lot of money available, both from the government, from private industry, investors, et cetera. And you have to give Operation Warp Speed credit as well. So in other words, everyone said there's a lot of money out there. So for the first time ever, like Moderna, for example, they were building their vaccine, they were manufacturing their vaccine in May of 2020, months before they even knew what the results would be. So that had never been done before. If we could do it again, great. I think that could only be done in a pandemic, unfortunately, when there's urgency and there's lots and lots of money out there by governments all over the world. They all said, it's worth the risk. We'll spend that money. We'll write those checks because if we can save a month, save any time getting a vaccine out quicker, then it'll save lives. But that is the key reason why they developed these vaccines so quickly, because for the first time ever, we did things simultaneously, including manufacturing while we were still testing and developing these vaccines.
Right. So on the topic of clinical trials, I remember every day I was growing impatient while trials were happening, and I was like, do it sooner, do it fast. So do you think? I mean, I know clinical trials are important. That's how we get to know efficacy and safety. But from your reading, was there anything we could have done differently to maybe accelerate it even more, or in retrospect, it happened as fast as it could have?
Well, in hindsight, there were ways to do it a little faster and to accelerate the trial process. It's important to remember that there were tens of thousands of people tested for these vaccines, and they didn't cut corners. And they could have gone a little bit faster, but I have to tell you that what if there had been some early on, some setback, someone got sick, God forbid someone died. Can you imagine? They're already in the United States. I can't speak for other countries. Oh, but I know India as well. There are a lot of vaccine hesitant people. In the United States, it's about 30%. Can you imagine if there had been some setback, even a minor one early on, where there was some rumor and then it turns out someone got sick and there was a mistake done? So to me, yeah, they could have done a little bit. We're talking weeks. They could have gone a little bit faster in hindsight. But I find it hard to criticize because this is the first time they were ever doing this vaccine, the mRNA as a vaccine in such a short time. And I give the benefit of the doubt to those working on the trials, because if they had messed up, can you imagine if half as many people would have taken these vaccines, the course of this pandemic would have just changed dramatically.
Right. So maybe this is a little bit of, I mean, related, but also off topic. Wanted to get your view on this whole anti-vax movement, particularly in the US. It was all over the world, all over the news. People weren't ready to wear masks, and particularly vaccine, all sorts of conspiracy theories. And of course, it intersects with the whole fake news, misinformation thing. But what do you think, what led to this? And do you have a view on a way to at least alleviate it, if not fix it altogether?
Now you're going to depress me, right? So
I know it's a really hard question, but it's also a very depressing one.
It's a sad one because not just for me. Can you imagine? I've talked to these researchers. They went all out to develop these vaccines. We're talking the researchers in academics, the government researchers, the corporate researchers, and yeah, they wanted fame and fortune, all that kind of stuff too. But they also really wanted to save lives and help people. And I write in my book about an individual named Juan Andres. Juan Andres, his mother-in-law died of COVID, and he was very scared early on about it. And he stocked up on toilet paper and tissues, and he got a third refrigerator for his family. And they thought he was crazy early on. They said, what are you talking? A third refrigerator? And he stocked it up with food. And then again, his mother-in-law died, and we all realized how scary this thing was. So for these researchers and scientists and executives who went all out, not only are there 30% in the United States, let's say, who won't take these vaccines, won't roll up their sleeves, but a lot of people are pointing fingers at them and accusing them of doing bad things, of harming, and they've gone all out. I know people within some of these companies that have stage 4 cancer, and they're still coming in and working on these vaccines and trying to help people. So it's very discouraging to see how many people are resisting. And to me, it reflects a few different things, especially in the United States. So in the United States, there's this individualism that we treasure, and it helped lead to these vaccines. There's a reason why all these executives, these companies, they come to the United States for the money and the support and sometimes the research. I mean, listen, India's got its own vaccine research, obviously, as a whole, enormous, the biggest vaccine makers in the world. But a lot of the breakthroughs were done in academic labs in the United States and elsewhere. And I cherish the individualism of this country too. Remember, I talked about mRNA and the history of mRNA, and it took these individuals to ignore the conventional wisdom and be and all the skeptics and to persist and be resilient. And that's a wonderful thing. But there are two sides of the same coin of that individualism in my country, at least. I can't speak for other countries. The other side of that coin are people who say, I believe in myself. I believe in my own research. I believe in ignoring science and ignoring my doctor. And I believe in my ability to go through YouTube and Facebook and Instagram and find the experts. And I believe I can ignore Tony Fauci and the government health experts and listen to my brother-in-law who heard something on YouTube about how these vaccines are harmful. And more than ever, we've got this faith in ourselves and in our abilities. And there are good parts of that and really negative parts of that. And it's also the case that everything is politicized in the United States and maybe broadly, globally as well. I wrote a book about fracking. It's called The Frackers, and it's about this revolution in the United States where we found all this oil and gas. And the same kind of thing. It's either drill, baby, drill, go, 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 pump oil, or it kills and it poisons. And I'm a centrist. I'm very much a centrist. And I believe that there are good ways of doing all these kinds of things. So I think there are very few of us. To get to your question, there are very few centrists today. I mean, look at the election in France this last week. More than 50% of the vote went to the far right or the far left. And so it's country after country. It's not just the United States where it's hard to be in the middle. And part of it is social media and how we go on Facebook and we have friends who think like we do. And we follow media that says things that we want to hear. And we're in a bubble more than ever. We individuals are in bubbles and we need to challenge ourselves. And I have friends who we disagree about politics, but it's good that we disagree. We try to listen to each other politely and with respect. And it opens my eyes. I'm not saying I do it properly, but I try to force myself. And more than ever, I think we're in these bubbles where we only hear people that agree with us, and it's not good for society.
Right. I guess this polarization, extreme polarization, is a silent pandemic that we'll have to grapple with, or we're probably already grappling with.
Yeah, and it's only getting worse, this pandemic, unlike the other one. Yeah.
So on the question of pandemic, since we are at the end of the conversation, I wanted to also pick your brain on what do you think this COVID pandemic has taught us in the sense of dealing with the next pandemic, which will inevitably happen. That's how biology works. Do you think we're better prepared to handle it, or we'll forget about it?
I do. No, I want to be optimistic. I think that we learned how government and private industry can work together. We've learned about mRNA and how quickly a sequence, once we have the sequence, we can develop a vaccine and test it quickly and roll it out quickly. So that's very reassuring. There's also all kinds of money, like we said, being made by these companies. So they're working on second and third generation vaccines, a pan-coronavirus vaccine for all the coronaviruses. And maybe you lump it in with flu too. So you go once a year and you get a vaccine for all the coronaviruses and flu as well. So I think we're better. In some ways, we are better equipped and better prepared. There's also the issue of misinformation. And I guess we're more likely to be suspicious of government leaders, of government health officials. And that's the scary part of it. So the science is better prepared, but society maybe not as well prepared.
All right. So the very last thing I want to get into is the process of writing a book of this sort. And I know it's the whole Pandora's box on its own, and it could deserve a podcast on its own. But tell us a little bit about when did you start writing the book? Did you write daily? Were you doing it parallelly to your day job at the Wall Street Journal? And most importantly, how did you fact check, given this was a highly scientific book?
So it's a highly scientific book, and I'm not a scientist. I took science in high school. That's the last time I touched science. So it was very scary for me. So in terms of the process, I was working at the Wall Street Journal at the same time. I was writing a lot of articles related to vaccines in the chase. So that helped me as well. That gave me a chance to do research and explore. But basically, I was up until about 3 a.m. every day, every night on average. If I went to bed around 1:30 or 2 a.m., I'd feel this guilt that I was slacking and not doing a good job. 3 a.m. was my sweet spot. And I would get up around, I'd get about 5, 6 hours of sleep and just do it again. And what happened was, I've never done this before. So I started the process in the summer of 2020, before we knew these vaccines were going to work. So I was risking my time and my effort, and I was hoping that they would prove effective. I didn't know how effective they were. The good thing is that the researchers were optimistic. So they were getting early indications that their vaccines were going to work. And I was betting that they would. So it was real-time reporting. I've never done that before. And I had to reach out to all these different organizations, companies, Moderna, Oxford, BioNTech, Pfizer, Novavax, J&J, and find the right people. Who are the researchers? And sometimes the companies don't even want you to know who they are. They let you talk to the executives, but I wanted to drill down to the people making the real innovations and the breakthroughs and how they were doing it. So it just takes a lot of questioning and pushing people and persistence. And I was hoping, but it also gave me hope. So it was a very difficult time for the world. I was locked down like everybody else. Usually for my books, I like to get out and travel and meet people and travel the world. And for this one, I couldn't. I mean, I could travel locally. I went up to Boston, Cambridge for Moderna, and some of these other companies locally. But I wanted to go to Germany to meet BioNTech. Instead, I had to do Zoom meetings and talk to people. And I was nervous. I wouldn't get to enough people. But I did. Eventually, I got people. Oxford wouldn't talk to me. Some people would talk to me. Adrian Hill, that really difficult person I told you about, he wouldn't talk to me, but others did within Oxford. So I'm very grateful. Oh, so to your question about fact checking, so I can't have any mistakes in my books. It would make me look like a fool, especially since I'm not a scientist. So I'm very, very, very lucky that there were a lot of scientists who were willing to help me and discuss topics and make sure my language is accurate and read chapters. So Jason McClellan, one of the heroes who contributed a lot, he went through every chapter. I hired a PhD, a biology PhD locally, a young woman, and we would do these sessions, and I would ask every question I had, and it was basically learning as I went along. So there were a lot of people. The world of science is very generous and very helpful, and when they sense that you're serious about it and that you don't want to make any mistakes, they're very helpful with their time. So I'm very grateful for all those scientists and researchers who took the time to help me write this book.
I mean, your book is special kind of nonfiction because nonfiction generally captures what has happened. Yours was when you started, vaccines were under development. So it's sort of like, almost fiction in your head in the sense of, did you have several endings in mind, depending on how vaccine approval would have turned out?
Yeah, well, it's scary. It keeps me up at night because I can write the first half, but I don't know what's going to happen in the second half. And
Yeah.
Listen, I needed at least a couple vaccines to work. If they all didn't work, then I just wasted my time. I spent a year just wasting my time. And there were things. I learned about science. I met interesting people, but it would have been a waste of time. If there have been some successful ones, but some failures, that would have been okay too, as long as there was drama. But thank God for all of us, all these vaccines have worked, even the ones that are maybe not as ideal, even the Chinese one and the Russian one, they're not bad. They're not bad vaccines. If they were the only ones in the world, I would roll up my sleeve for sure and take those. I get into them just a little bit in my book, but yeah, I was gambling to some extent. And also the end of the book is always something that I worry about. Not just, you talk about the approval, the authorization of these vaccines in November 2020, but even after that, I take you through some of the rollout and what happened afterwards. But I write about characters. That's the key. my approach is a spoonful of sugar helps the medicine go down. In other words, I'm going to write about really difficult topics, but I'm going to come at it through the people, the interesting people. And thank God there were a lot of really at least to me, fascinating characters, stubborn, arrogant, opinionated, neurotic, just competitive. They're really interesting. The world of science is really an interesting one, biotech in particular. So I was very grateful that I got to meet so many of these people and they would talk to me.
Yeah, and I'm very grateful you took this bet because this is definitely a momentous event in human history. The way we remember 1918 pandemic, I'm sure 100 years hence, we'll remember this time. And your book capturing our success, maybe it's too soon to call a success, but obviously saving millions and millions of lives. I think it's a very, very important contribution. I'm glad you took time out to do this.
Thank you for saying. And I think years from now, we'll appreciate the enormity of these achievements. Maybe we're too close to it right now, but I think it's modern science's greatest achievement. So hopefully people appreciate the vaccines, but also hopefully people enjoy the book.
Definitely. And once again, I really enjoyed your book. I hope everyone listening to this podcast goes out and grabs a copy. I highly, highly recommend it. And Gregory, thanks for coming on the podcast and talking to me. Enjoyed it quite a lot.
Thank you for your interest. And I love hearing from viewers, readers. If people have criticisms, that's great too. People have comments, please. I'm easy to find on LinkedIn or Twitter or email. So I like hearing from people. And thank you for your time and your interest.
All right. Bye-bye. Take care.